Thank you very much. You know, it's always a delight to be honored, but it's very special to be honored by an organization like the Chamber. You guys have come a long way. I was on this board in the 70s, in the days of, names won't mean anything to you, but we couldn't have filled a quarter of this room. So congratulations. And the Chamber is about as critical an organization one can imagine in working to build the future of Los Angeles, to building the future of the business community, and generally trying to make a better tomorrow. I've got a minute, so obviously my comments will be short. Incidentally, thank you, Chamber, for depriving me of the opportunity to watch another debate. You know, I've often been asked why I devote so much energy and time and resource to education, and have for the last 30 years. And let me just give you a couple lines in terms that I think are particularly relevant to the Chamber. The punchline is investment in quality education for all of our young people is the most important, the very most important investment in the future of this country that the country can make. Above all others, and I even include defense and national security and things like that. It has the greatest ROI of any investment this country can ever make. To assure a growing economy, globally competitive, and an informed, engaged, and upwardly mobile society, we're addressing the two essentials for a healthy and dynamic and everlasting democracy. So thank you again to the Chamber. This means a lot to me. Keep up your good work, and God bless all of you. Thank you.
Please welcome back to the stage, Mr. Joe Civic.
Hi again. It's my pleasure to introduce this year's recipient of this Distinguished Business Leader Award. This award is presented to an individual who not only demonstrates an extraordinary dedication to his or her business, but the greater community through their leadership and philanthropic efforts. Please join me as we take a look at the video portrait of tonight's honoree, Dr. Benjamin Chu.
Really, the reason why I'm a doctor is because when I was 3 years old, I got sick. I had rheumatic fever, and at the time, you know, they hospitalized you for months at a time. My earliest toy was actually a stethoscope. One of the pediatricians gave it to me because I was bored out of my mind. I have to say, my career is very unusual. It's not a traditional pathway. I loved cardiology, I mean, for obvious reasons. I had a heart condition. I could have been a very happy cardiologist, I think. But because of my concern about making a larger impact and really being upset that we couldn't really touch the people that in a way that I thought we needed to, I went down the pathway of public health and of systems change and administration. Kaiser Permanente is an integrated system. It's actually very unusual to see the physician group, our multi-specialty group, with the hospital and the health plan all under one roof. We actually provide care across a whole continuum, home care, even skilled nursing care, lots of emphasis on prevention. And so for me, in healthcare, it's really trying to make a difference in 3.5 million people that we take care of in Southern California. I think a distinguished business leader has to have a very compelling reason for what they do. And so we've actually been very thoughtful, I think, over the last decade or so about doing more and more in the community, in the schools. I mean, for example, we have an educational theater team that goes out and does thousands of performances, trying to get kids excited about good nutrition and exercise. For the last couple of years, we've been doing surgery days for members of the community who can't get access to needed surgery. So it's our doctors and nurses and staff volunteer. They come in on Saturdays, and we work with community health centers to find people who have waited sometimes years for needed surgeries. And it gives you that sense that you're really making a difference.
That very kind introduction, and thank you, ladies and gentlemen, for your warm and generous welcome. Governor Brown, Mayor Villaraigosa, and distinguished guests, it is a privilege to represent Kaiser Permanente this evening and to accept this recognition. I want to congratulate Harold Williams for his well-deserved acknowledgement with the Chamber's Civic Medal of Honor. And I applaud Wells Fargo for earning the Corporate Leadership Award. Ladies and gentlemen, I accept this award on behalf of the more than 6,000 physicians and 57,000 employees of Kaiser Permanente in Southern California, who work diligently, right, here you are, who work diligently every day to build healthy communities by delivering high-quality care and service to our members and our patients. I also want to thank them for their active roles and dedication to community issues through their personal and work-related volunteerism. The foundation of health for our neighbors, our employees, and our families is a healthy community. Improvements in community health happen as a result of working beyond the walls of hospitals and medical offices. It's done through community investments and partnerships. I know that many of you here tonight are working to make Los Angeles and all of our communities healthier places to live, to work, and play for our neighbors, our employees, and our families. That's part of what makes you leaders and what inspires you in your daily work and personal philanthropy. Tonight, I'm very excited to share with you news of a new initiative that we have just launched called HEAL Zones. HEAL stands for Healthy Eating, Active Living. We've just announced 6 $1 million grants to Southern California communities with high rates of obesity and other health disparities to help create long-term positive change. In addition to these 6 grants, 3 other communities will be sharing $650,000 in partnership grants to combat obesity. The HEAL Zones are part of our HEAL program that began in 2004 to address obesity and health-related conditions. Since then, Kaiser Permanente has committed more than $21 million in HEAL efforts across Southern California. Our HEAL Zone partners share the vision of transforming these communities so that walking and biking on safe routes, buying affordable fresh fruits and vegetables close to home, exercising in clean and safe parks, and participating in active after-school programs all become a part of a resident's daily life. Making life better is why Kaiser Permanente exists, and that has been our focus throughout our 70 years of serving Southern California. Thank you. So on behalf of Kaiser Permanente representatives here this evening, our labor partners, and our thousands of Kaiser Permanente physicians and employees, I want to express our deep appreciation for this acknowledgement of our commitment to expanding access to total health. Thank you again for this wonderful honor.